Are you familiar with the role of gap analysis in healthcare? The healthcare industry has many elements and functions that require constant analysis and adjustment. In today's video, we'll learn what a gap analysis is and how it can play such a vital role in the improvement of the healthcare industry. I'm Alex from Jotform. Let's go. In the healthcare industry, there's many moving parts. It's a broad spectrum of physicians, clinics, HMOs, hospitals, third-party providers, and patients, which are all connected through online networks that are full of sensitive data, meaning that it's both crucial and tricky to maintain excellence. Because of this, healthcare organizations use gap analysis to help governments and medical providers identify what needs to change in order to achieve better service and outcomes. Anywhere from global health organizations to small-town clinics, gap analysis is making an impact on the future of healthcare. So, let's go ahead and discuss 3 examples of that impact. First, there's the instance of the World Health Organization, or the WHO, preparing for the pandemic. Of course, COVID-19 isn't the first pandemic of the 21st century. There was the comparatively moderate H1N1 flu pandemic in 2009 that caused the WHO to face the possibility of a widespread pandemic. One way that the WHO began to prepare was by performing a gap analysis of the preparedness levels of different areas around the world. In this case, the gap analysis was a huge undertaking that took 4 years to complete. It worked to measure 3 essential pandemic capacities: detection, monitoring, and sharing of virus samples and information between countries. The gap analysis looked at regional data to quantify these core capacities in different countries, marking them from a level 1, meaning low, to a level 4, meaning high. For example, for detection capacity, the study found that 70% of countries deserved a rating of low to weak. This included roughly 80% of African and Southeast Asian countries. Ultimately, the gap analysis discovered that lab and surveillance capabilities were less than ideal in all regions, with Africa in particular having the biggest gap. While each pandemic is different and it's impossible to predict when one will arrive, gap analyses like this one are the key to bringing the world closer to a better emergency response. Our next example turns to how the state of Minnesota was able to prevent violence in healthcare with gap analysis. Healthcare facilities are high-pressure environments where a wide variety of people cross paths under sensitive situations. Because of this, violence is all too common in healthcare, putting clinical staff, secondary personnel, and other associated persons at risk. In Minnesota, they decided to directly address this issue. The Department of Health worked with several organizations to conduct a gap analysis with the intention of reducing violence in medical institutions throughout the state. To do so, they created an audit questionnaire for healthcare providers to identify weaknesses in violence prevention protocols and to make suggestions for how to improve them. The questionnaire was formed around the acronym SAFE, which stood for Safety Coordination, Accurate and Concurrent Reporting, Facility Culture and Accountability, and Education of Staff. Also, the audit considered an institution's ability to identify risk, conduct interventions, respond to incidents, and learn from past events. While the gap analysis focused on large medical organizations, it's still a shining example of an audit that directly pointed to gaps and highlighted specific follow-up actions. Our third example looks at a large health insurance company working to meet the regulations of the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. In addition to a commitment to patient health, medical providers are responsible for patient privacy. HIPAA, a complex set of regulations and laws regarding the storage and transmission of protected health information, or PHI, regulates the protection of patient data. All people working in healthcare must comply with HIPAA. The penalties for violating HIPAA are severe and costly. Maintaining HIPAA compliance is no easy feat, as it applies to nearly all patient interactions, including scheduling, storing medical records, sharing patient data, accepting patient payments, and more. In the instance of one case study, a leading health insurance company hired a consulting company to address HIPAA compliance throughout their organization. It took nearly 2 years, the mapping of more than 4,000 processes, the use of over 5,000 documents, and more than 25,000 PHI points to be completed. Of course, not all healthcare companies are that complex. For smaller medical providers, there are simple tools that can help, like the HIPAA-compliant online form templates offered by Jotform. These templates help to complete the daily tasks that involve PHI, such as gathering patient information, collecting payments, and managing consent. The right medical knowledge and capabilities are out there, but getting them to the masses can be a challenge. The COVID-19 pandemic has illuminated gaps between where healthcare is today and where it could be. When it comes to health, the stakes are high, which is why gap analysis in healthcare is an essential tool with the potential to save lives. Let's go ahead and take a moment to review. We learned that healthcare organizations use gap analysis to identify what needs to be changed in order to achieve better service and outcomes. 3 examples of gap analysis in healthcare are the WHO and the 2009 H1N1 flu, the state of Minnesota working to reduce violence in healthcare settings, and finally, a health insurance company evaluating HIPAA compliance throughout their organization. Again, I'm Alex with Jotform, and thanks for watching. See you in the next one.